sure with this and adequate social distancing, I'll be able to take off my mask as I address you. And I'll deliver it into sheets so that I don't infect the environment, assuming I have it. But I don't. Good. So, thank you very much, our hardworking National Communications Officer, Mr. Sami Jamfi, for the opportunity and the invitation to share with the good people of Ghana, through you, the media, aspects of the People's Manifesto which bothers on health. And thank you very much for attending. If there was ever any doubt, I'm sure that doubt has been cleared by now, that the NDC is poised for victory in the presidential and parliamentary elections come December 7. To quote our flag bearer, His Excellency John Dramani Mahama, when he launched our 2020 campaign in Dwenase Sefiwioso yesterday, we need to win the elections to deliver true change, not for ourselves, but for our dear country. Ladies and gentlemen of the press, welcome. It is obvious the sovereign people of Ghana are yearning for change in this election. Not just any change, but quality change. And it is this quality change that the tested and trusted President John Dramani Mahama and his running mate, Professor Nana Jane Opoku Agyeman, NDC parliamentary candidates, and the rank and file of our party are offering. We have worked very hard, and we are working even harder. We have an impressive record of achievement, and most importantly, we have a superior manifesto, the People's Manifesto. There is hope ahead for every Ghanaian, because God willing, on December 7, we will go to the polls and change this government, which has been a gross disappointment, divided instead of uniting our people, and visited socioeconomic pain on many a Ghanaian in several facets of our national life. This includes the health sector, which is the focus of today's press conference, specifically free primary health care. Ladies and gentlemen, with free primary health care, you will recall that during the historic outdooring of Professor Nana Jane Opoku Agyeman at the University of Professional Studies, among other significant promises, such as paying depositors of all affected financial institutions all their monies within 1 year, President Mahama, for the first time, announced his program to roll out the free primary health care plan, God willing, when voted into office. Free primary health care will be the single largest social intervention under the Fourth Republic. The free primary health care plan will deliver preventive health, health promotion interventions, and curative care. It seeks to provide quality health care for all Ghanaians at no cost to the individual. And President Mahama has demonstrated his unquenchable determination to implement it. Under the free primary healthcare plan, no Ghanaian will pay for healthcare in district hospitals, in polyclinics, in health centers, and in CHIPS compounds. Notably, you will not need a national health insurance card to benefit from free primary healthcare. Ladies and gentlemen, free primary healthcare is very important and critical because health is integral to national development. With free primary healthcare, we shall significantly reduce avoidable deaths due to hypertension, strokes, diabetes, kidney disease, and many other diseases. This significant reduction in the death burden will help improve the quality of lives for those suffering from such diseases. In addition, we shall intensify public education on preventable lifestyles that can lead to such diseases. Under the free primary healthcare plan, Ghanaians, teachers, health workers, civil and public servants, journalists, students, farmers, fishers, artisans, drivers, you name them, will no longer have to postpone the need to see a doctor because they neither have money nor health insurance. With free primary healthcare, free means free. Walk into the health facility and you will receive care. In this election, Ghanaians will choose between the candidate and the party with a clear promise to provide health care for all Ghanaians, and the NPP, which remains locked up in the past and has shown through the abandoning of health infrastructure that it is not committed to achieving health for all Ghanaians as stipulated by the Sustainable Development Goals, specifically SDG 3, Health for All. Ladies and gentlemen, even before the SDGs, Ghana had subscribed to the Alma Ata Declaration in 1978. The Millennium Development Goals, 2000, the Kampala Declaration, 2008, and recently, 2018, the current government also subscribed to the Astana Declaration. Over the years, since 1978, providing health for all Ghanaians through primary health care in a manner which is affordable, accessible, and of good quality has eluded us. We believe this, coupled with the gaping vulnerabilities revealed within Ghana's health system during this coronavirus disease pandemic, are some of the key reasons defining election 2020. In this election, God willing, Ghanaians will choose President Mahama, who provided the University of Ghana Medical Center, the Ridge Hospital, and a raft of health infrastructure and durable interventions across the country. Once again, we believe Ghanaians will choose President Mahama, who has an explicit and well-thought-through promise to provide free primary health care, and not his opposite contender, who has failed the health sector as president and is showing no bold and credible commitment towards the achievement of health for all Ghanaians. Ladies and gentlemen, globally, providing health care is focused on prioritizing primary health care. This is premised on the fact that keeping citizens healthy has been shown to minimize overall healthcare costs, increase quality adjusted life years and life expectancy, ensure adequate skill mix to guarantee accelerated economic growth, and decrease the pressure on secondary, tertiary, and quaternary healthcare facilities. And this includes addressing the dreaded no-bed syndrome. In Ghana, where outpatient per capita, that is the number of times the average Ghanaian visits a primary health care facility, is less than 1, health-seeking behaviors are skewed more towards the curative than the preventive. Experts have suggested many reasons for this poor health-seeking behavior. Among the reasons include high out-of-pocket cost, low national health insurance coverage. Less than 40% of Ghanaians are on health insurance as we speak. Long waiting times. You go to the health facility and you have to wait for an average of about 2.5 hours or more, 161 minutes. This excludes the travel time from home to the health facility and your journey back. And last but not least, poor customer service at primary health care facilities. And this has also been explained partly as due to the overwhelming numbers and all. These need to change in line with our changing disease burden pattern. We indeed need free primary health care to make Ghanaians access health care, including appropriate treatment of common diseases and injuries, and provision of essential drugs at no cost to them. Free primary health care will also prioritize and improve the responsiveness of the health system. Ladies and gentlemen, the next NDC government is determined to fix the high out-of-pocket payments. With free primary health care, nobody, we mean no Ghanaian, will pay a peswa at any primary health care facility when he or she is attended to. Free primary health care will reduce long waiting time. As I said, sometimes you spend over 2 hours at a health facility before being seen. Ladies and gentlemen, another benefit of free primary health care will be a drastic reduction in the over 2.5 hours long waiting time, which overwhelms health workers, wastes the time of patients and their families who will be accompanying them, invariably leads to poor customer service at our healthcare facilities, and on the national scale, reduces productivity. If a journalist has to go to a health facility and has to spend all this time, it means that for that whole day, you may not be able to work. Same applies to a teacher, same applies to a nurse, same applies to a doctor, same applies to public and civil servants who will be going to these health facilities. So national productivity also suffers. For many people with chronic diseases, such as hypertension and diabetes, most of their routine tests and reviews do not need to take place in the traditional brick-and-mortar health facilities. This is because personal information such as blood pressure, pulse rate, height, weight, body temperature, oxygen saturation, etc., can be performed remotely without these individuals physically visiting the particular designated health facility, as in the district hospital, the polyclinic, the health center, or the CHIPS compound. And this is where we will speak about bringing in pharmacy shops, drugstores, and all to assist, so that the pharmacy shop that is closer to you, you visit that, to reduce the long waiting time. Other semi-invasive tests like blood glucose level can be done by using rapid diagnostic kits. And these tests are normally very, very simple to be done. You don't have to go all the way to the district hospital, to the polyclinic, to the health center, or to the CHIPS compound for it to be done. Drugstores and pharmacies will be empowered participate in this. It will reduce your waiting time. The patients will have these tests done at accredited local pharmacy or drugstores, as the case may be, at a fee to be paid by government. This will also diversify the range of services that pharmacy and drug shops offer and create more jobs. In addition, we will connect patients with medical laboratories, both public and private, that can perform other invasive tests by using their mobile laboratory technicians. This will also create more jobs for drivers, for designated motor riders, and laboratory technicians. As a result of the care they will be receiving outside of the health facilities, people will visit district hospitals, polyclinics, and CHIPS compounds only when it is necessary to do so. This obviously will reduce congestion in our health facilities, reduce waiting time, and make it possible for Ghanaians to seek health care on time. With this enhanced health-seeking behavior, diseases will be picked up early by health professionals and managed. This early detection of diseases due to free primary health care will reduce medical complications, which usually require inpatient care. We are in the month of October. It's Breast Cancer Awareness Month. If there is free primary health care and our mothers, our sisters, our wives are going to the facilities, even previously, before October, it means that if there is any lump, it will be picked up early and the necessary interventions put in place to avoid whatever lump developing into complications, assuming it is cancerous. As a result, there will be fewer hospitalizations, and in tandem with other interventions, the dreaded no-bed syndrome will be addressed. As we have already said, this means that there are job opportunities for pharmacists, for those who manage the drugstores, for lab technicians, for drivers who will be running the mobile labs, and for riders who will be transmitting the lab results. And some of these are already happening, particularly in the private sector. We want to scale it up. So, over and above the jobs to be created under free primary healthcare plan stated, there is also excellent news for physician assistants, registered nurses, midwives, community health nurses, pharmacists, doctors, and allied health workers, and other health sector entrepreneurs. Free primary health care will require additional health human resource. This heralds more jobs for the good people of Ghana. The Mahama-led government will also enlist the services of private sector providers and support their facilities to participate in the delivery of free primary health care to Ghanaians. In addition, in order to ensure that healthcare reaches all Ghanaians in every corner of the country, health professionals, including doctors, physician assistants, midwives, nurses interested in private group practice, will also be given the needed stimulus to set up and render quality service to Ghanaians. And this also means that more employment within the health sector. I want to draw your attention to free primary health care and how it will integrate e-health and save cost. Ladies and gentlemen, you may recall that President Mahama successfully piloted e-health in Kolebu Teaching Hospital, Kolebu Polyclinic, and Zebila District Hospital, among others. You also recall he provided the ultra-modern Tier 3 600 rack space National Data Center, the biggest in West Africa, sitting right behind Parliament House. He also provided the LTE 4G network and the over 800 kilometers Eastern Corridor fiber optic. He also provided the 112 National Emergency Number and many others. I'm sure you are familiar with the 112, which is used during emergencies and has been very, very helpful during this COVID period. I was President Mohammed's minister. I launched the 112 National Emergency Number. And so when we are talking about free primary health care and e-health, we are saying that these monumental achievements in the ICT sector will be leveraged to enhance the implementation of free primary health care. Deploying and expanding e-health facilities, as well as improving access, will be one of our major tools of delivering on our promise of free primary health care to all Ghanaians. For example, patient data will be collected with all the appropriate patient consent protocols and confidential guidelines into a national cloud-based electronic patient record system. Also, the current e-tracker for community health nurses to collect point-of-care data of patients as they provide services and undertake home visits from CHIP compounds will be expanded to cover the whole country in an equitable manner. Thus, as we have highlighted, a clinician could access this information remotely at any point and independently take care of a patient without the patient necessarily walking or traveling to go and meet the physician or the clinician. And it could be a physician assistant, it could be a midwife, it could be a doctor. We will also enhance and scale up the use of ICT through teleconsultation and telemedicine across the country. The features will be enhanced to include patient-doctor video consultations. And to simplify it, we have lots of WhatsApp video chats these days, lots of Skype chats these days. We are just leveraging and mainstreaming these within the health system. And we believe that with this, we will be able to answer some of the challenges. By using this approach, patients across the country, from Paga and the borders of Burkina Faso to the north, Elubo to the west, and Aplao bordering Togo to the east, including all coastal towns and all Ghanaians within Ghana, can be seen by a clinician anywhere, or a physician assistant, or a midwife, or a community health nurse who you may need assistance from. This plan will also help address the acute shortage of health professionals in many deprived and rural areas, because they will be seen by doctors who may even be in Accra, Ho, Kumasi, Takoradi, Cape Coast, via the power of ICT. Furthermore, this inherent efficiency enhancing and cost-saving attribute of ICT-driven free primary health care will cut down overhead cost of running and maintaining facilities. What this means is that a lot of paperwork will be a thing of the past. And most of the time, when such policies are implemented, you go to the facility and they say, oh, it is free, but you have to pay something for the card. You have to pay something for this. If through ICT, we have taken away paperwork, paying for cards, paying for folders and all, it will be clear that you do not have to pay for this, and this will also save time. Digitization of prescriptions will also improve the fight against counterfeit drugs and provide an audit trail that will become a valuable tool in the fight against fraud in the health system. Free primary health care will make NHIS better. Ladies and gentlemen, the free primary health care plan will make the NHIS better because it will pay for primary care preventive and promotive health. Let me clarify once again that a Ghanaian will not need a national health insurance card to benefit from free primary health care. Ladies and gentlemen, this means, unlike the NHIS, you do not have to pay a premium to benefit from free primary health care. My national communication officer says I should repeat. I will. Ladies and gentlemen, the free primary health care plan will make the NHIS better because it will pay for primary care, preventive and promotive health. Let me clarify once again that a Ghanaian will not need a national health insurance card to benefit from free primary health care. Ladies and gentlemen, this means, unlike the NHIS, you do not have to pay premium to benefit from free primary health care. We believe this will strengthen the ailing financial health of the NHIS and afford the scheme an opportunity to pay debts owed service providers. After all, expert opinion and research is replete on this, suggest health insurance is insufficient to ensure universal health coverage. You need other interventions. So free primary health care will exist. You don't have to pay premium. You will access health care free at the district hospital, polyclinic, health centers, CHIPS compounds. Health insurance will take care when you are referred to the regional hospital and the tertiary centers like Kolebu Teaching Hospital. In Ghana, so far, the national health insurance does not even cover 40% of the population. That is the fact. That is the reality. The national health insurance does not even cover 40% of the population, notwithstanding all the efforts that various governments have exerted. The facts. Between 2017 and 2019, the NHIS recorded an increase of 0.8% in coverage over the 3-year period, 0.8% cumulative. What does this mean? If you contrast this with the estimated 6.6% increase in the population of Ghana over the same period, growth rate of about 2.2 for our population, 2.2. NHIS doing 0.8% means that you are way below even catching up, taking care of new people who are being added on. And I'm talking about the people who really even need it the most. And so this is the verdict. If you contrast this with the estimated 6.6% increase in the population of Ghana over the same period, 2017 to 2019, you will understand why the NPP's promise in this election to use the NHIS to achieve Sustainable Development Goal 3 held for all Ghanaians within the next 9 years cannot be trusted and must be rejected by the electorate. In 3 years, cumulative increase, 0.8%. Cumulative estimated population increase, 6.6%. How can you catch up? They do not have a credible plan for health for all Ghanaians. We do. Vote John Mahama and NDC for free primary health care. wish to assure you, under the next NDC government, the NHIS will concentrate attention and efforts to protect citizens against the cost of healthcare at the secondary and tertiary level. And with a well-functioning free primary healthcare, you can be confident that the patients at the secondary and tertiary levels will be reduced because early warning signs of disease will be picked up through screening and attended to promptly. Now, I move to free primary healthcare and more. Other issues that are contained in the People's Manifesto. Ladies and gentlemen, in addition to free primary healthcare, the People's Manifesto also captures other significant promises in the health sector. The list is not exhaustive. The promises include: 1, implement tax waivers to assist health workers to acquire means of transport, vehicle, to respond to emergency calls. 2, establish a housing scheme for health workers and provide residential facilities at all health facilities for health workers. 3, revise and expand the definition of frontline workers and harmonize disparities in the salaries and conditions of work of health workers. 4, amend the National Pensions Act to allow health professionals who have contributed to SNIT for 10 years and above to collateralize their contributions for mortgage loans. 5, employ the backlog of all unemployed qualified health professionals. And this stands to reason that those who will be trained will also be engaged. And with the elaborate plan that I've spoken about free primary health care, you understand that there will be room, there will be capacity for them to fill and to work. 6, support health professionals with insurance to cushion them from unintended consequences of their practice. People are becoming more aware of their rights and are taking health professionals on medical legal grounds. So there's a need for health professionals to be insured. Support bilateral and other exchange programs for our health personnel to expose them to best practices around the world, whilst supporting the pursuit of professional development by health workers. 8, establish a Professor Jacob Planwool Endowment Fund for medical and surgical specialist training. This endowment fund is named after Professor Jacob Planwool. He died, unfortunately, of COVID, and he has paid his dues, was a physician, consultant physician, a physiologist, has taught many medical students, and was also the head of the Ghana College of Physicians and Surgeons. This is in his memory to establish a Professor Jacob Planwool Endowment Fund for medical and surgical specialist training. 9, scale up the training of physician assistants and emergency physicians, as well as create more jobs for community nurses and other health professionals through the implementation of free primary health care. And 10, institute a National Health Workers Day and establish an award scheme for deserving individual workers and best facilities. This will include private sector facilities. Ladies and gentlemen, in conclusion, the time has come for Ghana to walk the talk and achieve health for all through free primary health care. We cannot continue to pay lip service to the health of the people of Ghana, particularly the poor. The evidence support free primary health care to deliver health for all Ghanaians. Ghana can do it. As the Nobel laureate Amartya Sen puts it, and I quote, "Many poor countries have shown that basic health care for all can be provided at a remarkably good level at a very low cost if society, including its political and intellectual leadership, shows high-level commitment." End of quote. Ghana is not a poor country. Ghana can do it. Together, President Mahama, Professor Nana Jane Opoku-Agyeman, and the NDC as a unit is showing that commitment. Free primary health care will emphasize preventive and promotive health. Primary care eliminate out-of-pocket payments, reduce long waiting time, and make the NHIS better. This means that if you are seeking health care under the next NDC administration, in a district hospital, it is free. In a polyclinic, it is free. In a health center, it is free. And in a CHIPS compound, it is free. Ladies and gentlemen, and above all, it will make Ghanaians happy once again as they seek health care in comfort without worrying about payments from their pockets. Good health will drive Ghana's socioeconomic growth and development. We need you to be healthy to drive the $10 billion big push infrastructure agenda for all Ghanaians. But to make this vision a reality, we need your vote on December 7th. Vote John Dramani Mahama for jobs and prosperity for all. Vote John Dramani Mahama for free primary health care to deliver true change, not for ourselves, but for our dear country. Thank you. Okay, sure. Let me speak.
When you have a medical doctor here, and you know that you are safe. Ladies and gentlemen, you've heard Dr. Edward Omanebuama on aspects of our People's Manifesto pertaining to our health policies for the people of this country, particularly the free primary healthcare policies and other policies that he has outlined. Thank you very much, Doc, for that brilliant and informative presentation. The key highlights for me is that free primary health care will be the single largest social intervention under the Fourth Republic when implemented under the next NDC Mahama government. And that under free primary health care, no Ghanaian will pay for health care in district hospitals, polyclinics, clinics, health centers, and CHIP compounds. Doc also indicated that not only will free primary health care help the nation realize the UN sustainable goal of ensuring access, universal access to healthcare for all Ghanaians, but that it will reduce avoidable deaths due to hypertension, strokes, diabetes, kidney disease, and other diseases. He's spoken to us about the benefits of free primary health care. It will create jobs for physician assistants, registered nurses, midwives, community health nurses, pharmacists, doctors, and allied health workers. He says it will reduce the long waiting time that we spend in our hospitals and healthcare facilities, and so many other advantages that come with this policy. The New Patriotic Party, led by President Akufo-Addo, so far hasn't been able to outline any policies for the health sector of this country. They are offering the people of this country virtually nothing when it comes to health. You have listened to our well thought out policies for the health sector, policies which emanated from broad consultations we held with the people of this country, particularly professional groups in the health sector. At this stage, we will open the floor for a few questions. Doc will respond to the questions, and immediately after, do a summary of his presentation in the Twi language in just 7 to 10 minutes. We realized that during the Twi, presentation at our weekly press briefing, the room is normally noisy because you have English stations removing their cameras and moving, up and down. Please, we humbly appeal to you to remain in your chairs, let your cameras be in their position, and let us finish the press conference before the movements begin. Because the pre-presentation is equally important to us. Until he is done, we are not done. Ladies and gentlemen of the media, before we open the floor for questions, as Doc was speaking, we were joined by the former Secretary of the Ghana Medical Association of Ghana, who happens to be the spokesperson, one of the spokespersons of the NDC on health. Ladies and gentlemen, let's welcome with a round of applause Dr. Jihu Apia. He's here to support the team. And so we'll allow for questions at this stage. If you have a question, kindly come to my right-hand side. You tell us your name, your media organization, and then you keep your question short and simple. Please, can you give us sound on that microphone? Okay. Okay, so use this microphone. So you can use this microphone to start with. While the other one is
All right. My name is Joseph Armstrong. I work with TV3 and Unia TV. I have two questions. First of all, I just want to ask, at which stage do you describe healthcare as primary and secondary, and what kind of, when you talk of primary healthcare, what kind of health are you going to deliver to people? And then secondly, we have the NHIA. Okay, so if you say if with the free primary health care is going to make the NHI better, is it not a way of probably collapsing the NHI card? Thank you.
okay, use the mic.
Good afternoon. My name is Kudu Adams from Ghana News Agency. My question, I wanted to find out with the free SHS, how do you intend to finance it? What? The free primary health care. How do you intend to finance it?
Thank you very much.
Very.
Yes.
Okay, so it's just a follow-up to this. The specific costing, I'm Sandy from JoyNews. So the specific costing line by line in terms of this, and then, like a colleague also asked, which specific healthcare conditions would require the primary healthcare? Thank you.
Thank you very much. Lantam, I think that will be the last one. Lantam from GH1.
Yes, you talked about, you talked about it will cover from polyclinics, district hospitals, health posts, and all of that.
Health centers, clinics, polyclinics, district hospital, CHIP compound.
So it means those who will go to pick up facilities will have to use the National Health Insurance.
Yeah.
Here's the case that over 40% of Ghanaians are not on the National Health Insurance. So if someone who this policy is targeting happens to find themselves in an enclave where they don't necessarily have access to any of these kind of facilities, but the nearest facility is, say, a big hospital, and they have to go there and they don't have a National Health Insurance card, how is the free primary health care going to come in to help that kind of case?
Thank you very much. Doc, I'm sure has written all the 4 questions, and I think 3 questions. One was a repetition, and we'll answer the questions at this stage, after which he will give us a quick summary of his presentation in the P language. Thank you.
Thank you very much, and indulge me as I continue to sanitize the environment. There was a question which borders on definition, which is which stage in healthcare do we say primary, secondary, or tertiary? Okay. You want me to take it off?
Yes, you need to, for the sake of power.
I will. At which stage? So that borders on definition. Okay. As I spoke, and when you receive the test, you realize that the operational definition of the free primary health care we are talking about has to do with prevention, health promotion, and curative care. Three things. And this is a very important issue that we need to clear doubts that usually worry many, even when it comes to some experts within the field. Some people confuse primary health care with primary care. Primary health care sits on top of primary care. So, the curative aspect is under primary health care. The health promotion aspect is under primary health care. And the prevention aspect is also under primary health care. So if you heard me talk about, with free primary health care, we are going to empower pharmacy shops, drug shops, and all to be testing the semi-invasive test, like fasting blood sugar, random blood sugar, blood pressure, checking body temperature. Those ones. It means that when we are checking these things for someone who doesn't have the disease, we are screening. And having screened that person, if the person is found to have the disease, you then refer the person either to a health center, a polyclinic, or a district hospital, as the case may be. So prevention, health, education is ongoing. You are doing that. You are dealing with other things that will prevent lifestyle changes and all. It's under free primary health care. Health promotion, lifestyle changes. That is also under free primary health care. And then the care in the facilities. That is the levels of care. And in healthcare, you can see the levels of care as what? Primary. And the primary, theoretically, ends at the district level. From the CHIPS compound up to the district level. Secondary, that is the regional hospitals level. Then you go to the tertiary, like Kolebu Teaching Hospital, Konfanoti Teaching Hospital, the teaching hospitals. And then you have the quaternary. Quaternary, so far in Ghana, we will pass the University of Ghana Medical Center as a quaternary center. In name, for now, because of the delays that this government had to subject the facility to, we have not been able to unleash the full potential of the University of Ghana Medical Center as a quaternary center. It had to take a gentleman to go on a one-man demonstration. So in terms of level of care, primary care will be from CHIPS compound all the way to district hospitals. Then secondary care will be at the regional hospitals. tertiary care at the teaching hospitals. And in terms of quaternary care, in Ghana for now, we may pass the University of Ghana Medical Center. What this means is that if you are conceptualizing a free primary health care, you should be looking at the district hospital all the way to the CHIPS compound. And that is why we say if you went to the district hospital, care will be free. If you went to the polyclinics, care will be free. If you went to the health center, care will be free. If you went to the CHIPS compounds, care will be free. Let me add, sometimes you may encounter a question that says that, but some care that will be taking place in the district hospitals are beyond primary care level. That is true. But you see, if you put policies in place like that, by saying that, okay, these are the gamut of cases that will go to the district hospital, these ones are free, these ones are not free. Implementation even becomes a problem for the managers of the district hospital, because a patient may come with a condition which may not be free and another condition which may be free. Do you dichotomize the patient if the patient doesn't have money for the part that is not captured by the free primary health care? That is why, knowing this and not creating administrative problems, we decided to add all the care at the district hospitals to the free primary health care plan, and not to segregate that this is secondary care, so it will not. So that is an operational definition. So this, I want you to keep this in mind. If anyone calls free primary health care primary care, listen to the person, but afterwards correct the person that free primary health care goes beyond primary care. It includes prevention, it also includes health promotion. Having dealt with this, there was this question about free primary health care making the NHIS better. And then a question came, will it not collapse the NHIS card? I want to tie this, because the theme, the thread is about NHIS. I want to tie this to the question about what happens to those without NHIS when they go to secondary and tertiary facilities. You realize that these two questions are sort of at the opposite ends of the issue. In one breath, the first question is asking whether free primary health care is not going to collapse the NHIS card. It will not. It will make the National Health Insurance Scheme better. But that is on one leg. On the other leg, this questioner who is asking about what happens to those who do not have NHIS but would have benefited from free primary health care and may be referred to secondary and tertiary facilities, what happens to them? Inherent in this question is the appreciation that we still have a chunk of our populace, of Ghanaians, who do not have the national health insurance. How do we plan for these people when we refer them? For instance, if this person is being referred for a cancer treatment or for kidney disease treatment, you realize that in the People's Manifesto, we have said that we will set up a cancer and kidney disease trust fund. And this cancer and kidney disease trust fund is built on the public spiritedness of the media, Ghanaians, patriotism. What do we mean? Whenever we have seen people in distress, people with distended abdomens, permit my saying, with tubes running through them, seeking help financially for surgical and medical procedures, our media quickly comes to their aid. And you project it. We want to harmonize all this so that together we will form a consortium of the willing to set up a cancer and kidney disease trust fund where we will all contribute into, assuming you are even contributing 50 pesos a month. or 50 pesos, even every 6 months. Another may contribute higher into this fund, such that if the person approached the trustees, and the way trustees perform, the way trusts run, it is not going to be a fund solely controlled by government. All stakeholders are going to be on the board of trustees. So they will determine the distribution of these funds to take care of said people who may be having cancer or kidney disease and will require care. This is one such example. And you are doing it already, and I commend you for it. But we need to bring your energies together and scale it up. So, yes, the two questions. One fears a collapse of the NHIS card. Not just the card, but the scheme. I'm assuring you, we are assuring you, free primary health care will make the NHIS better, because the NHIS, as we speak, is heavily indebted, and we must clear the debts. To be fair to governments, including this government, 3 years after the implementation of the National Health Insurance Scheme, the scheme was set up in 2003. Its operationalization started somewhere in 2005. By 2008, when the President Kufuor government left office, so 2005 to 2008, 3 years, the first systematic review of the National Health Insurance Scheme that was done by Witter and Gashon revealed that the scheme was indebted to the tune of $34 million US. You understand? So, ab initio, right from the word go, these indebtedness have existed. Are we going to continue over the period like this? We need to free the National Health Insurance Scheme of some of these financial burdens. The scheme can concentrate on secondary and tertiary care, so that central government, in an equitable manner, having collected taxes, tax and non-tax revenue inclusive, will spend money on free primary health care, so that from the district hospital level, through the polyclinics, to the health centers, to the CHIPS compounds, healthcare will be free. And we also invest in prevention. We will also invest in health promotion. With that, the National Health Insurance Scheme can breathe some freshness, regenerate, rejuvenate, settle its debts, and even take care of those who will subscribe to it better. And in fact, we will also even encourage that once government is taking care of the free primary health care, as individuals, we will encourage that you subscribe to forms of health financing, and they will include the national health insurance, they will include private health insurance schemes, they will include medical savings accounts that people also have for themselves. Medical savings accounts operate in places like Singapore, so that also can be done. And medical savings account also comes with some incentives from government. So we have a clear plan. The challenge is that if you opt for National Health Insurance Scheme as the journey towards health for all, you will not get there in the next 2 decades. Why do I say so? Sustainable Development Goal 3, 2030. We are in 2020. So 9 years from now, we enter 2030. You have a health insurance scheme that in 3 years has grown 0.8%. And as of now, 40% of the population. So how do you cover all Ghanaians in 9 years if you are using the National Health Insurance Scheme? You have to think outside the box. You have to look for an intervention that the economist will say moves you beyond the production possibility frontier of the National Health Insurance Scheme and establishes a new frontier. That is the only way that we can accelerate our journey towards health for all. Then there was a question about specific diseases. So I've already explained CHIPS compounds, health centers, polyclinics, district hospitals. So all the diseases that will be treated there will be covered by free primary health care. Now we come to costing and where we will fund it from. In fact, one of the most easiest questions to answer about free primary health care is the issue of costing. So let me assure you, it is the easiest question to answer. What do we mean? Evidence suggests that the cost per capita of free primary health care is between $8 to about $12. We also know that in Ghana, the average Ghanaian visits a healthcare facility less than once in a year, about 0.97. Our population is about 31 million. So assuming you are to use the lower estimate of $8 times 31, it takes you to about $248 million. In Ghana cedis, it is 1.4 billion. But you see, when you are costing, you need to take into account assumptions. President Mahama, in outdooring Professor Nana Jenu-Poku-Agyeman, said free primary health care will start at the end of 2021. That means that we will take time to prepare, put systems in place, the e-health and all efficiency-enhancing measures. Evidence also suggests from the ACCA that inefficiencies within the health system is very, very high. It will amaze you. Sometimes I don't believe it even myself. But let's all understand that not all will be due to corruption. Some are as a result of paperwork and those things. So if you eliminate a paperwork, you enhance the inefficiency. So with all this, but assuming that inefficiencies have been eliminated and all, but assuming that you are even still dealing with 1.4 billion Ghana cedis per this calculation, which takes 31 million population, it means that for 1 year, what do you need? Between 2017 and 2020, revenue from crude oil alone, saved for COVID, according to the budget statements, would have been over 20 billion Ghana cedis. Between 2017 and 2020, revenue saved for COVID from crude oil and gas, hydrocarbons alone, saved for COVID, would have been 20 billion Ghana cedis. When the people of Ghana say that we do not see what the oil money is being used for, we must be answering with some of these concrete programs. But you see, it is not all that money that will be used. And that is why we say that we will use the consolidated fund. And the consolidated fund, there is a part of the oil money that comes into the consolidated fund. That is what we will use, and part of other tax and non-tax revenues that come into the consolidated fund. So I've helped you with some figures. Let me also help you with what you should not take hook, line, and sinker when you hear others say that, oh, elsewhere it is 4 times a year, blah, blah, blah. Yes, that is in the middle to the long term. When the program starts, you are not going to have that kind of frequency that we are talking about. So we have looked at it, we have thought through it carefully, and we think that free primary health care is needed. And like Amartya Sen said, we have to commit ourselves to it. Our nation is not a poor nation, and we need to commit ourselves to it. I think that with this, I have responded to the various themes that run through the questions. Enunti minuanom meka chi kakra. Ye janom ye mamenom Ghana for. Ye manifesto no ye friend of People's Manifesto ye. And sempa bebre ewum ema Ghana for. Na People's Manifesto ye manifesto a emu nsem no ehwam efi Ghana for nchen ankasa na ebaaye ye ba mu nchen ye betie mu President Mahama echo regions bi through social media nso ye gada information na nea ye hu ye ne say assemble ko na edama koma so pa ne say nipa bebre na se omo yare kra mpo a omo kɔ chips compounder ɛyɛ na sika kakra mpo a ombetua no ayɛden fi so man ni mu ayɛden omo kɔ health center ɛno nso no ombetua kakra na ayɛden omo kɔ polyclinic na obetua kakra na ayɛden district hospital na ayɛden ɛna ade a yɛde bibi ba a yɛfrɛ no free primary health care no ne kyerɛ ne sɛ President Mahama eba bɛyɛ a president ɛtoto nneɛma yie sania ayiwaka no okɔ district hospital ɛbɛyɛ free okɔ polyclinic ɛbɛyɛ free okɔ health center ɛbɛyɛ free okɔ chips compound ɛbɛyɛ free wuntua sika wuntua taku mpo na ɛno ɛna yɛahwɛ hu sɛ ɛnyɛ hwɛ a yɛbɛhwɛ wo hɔ ne pɛ nanso yɛmpɛ sɛ wobɛkɔ asipiti na asipiti na wokɔ no wokɔ ɛkɔtenasia ebia dɔnhwere mmienu ɛne fa akyi na yɛnhwɛ wo fi sɛ nipa a makɔ hɔ no bodɔɔso ɛno nti nea yɛreka ne sɛ drug store na ɛbɛn wo pharmacy store na ɛbɛn wo no yɛne ɔmo ɛɛba bɛdi ntawantawa aka yiti abom aka yadwen abom aka ɔdɔ abɔdom na care na ɔmo provide no yama ɔmo apagya care no na aban yɛbɛtua sɛnea ɛbɛyɛ a ɛnyɛ obiara korampo na ɛbɛhia sɛ ɔbɛkɔ district hospital ana ɔbɛkɔ polyclinic ana ɔbɛkɔ health center ebia na ɛyɛ o blood pressure pɛ ɛna wopɛ sɛ woyɛ dɛ o check BP wokɔ a ne yɛakyɛke ama wo sɛ ɛbɛhia sɛ yɛma wokɔkɔ hu doctor na wayɛ dɛ wakɔ akɔhu doctor ebia na ɛyɛ umogya emu ɛne yɛpɛ sɛ yɛhwɛ ehu sɛ ebia diabetes wɔ mu a na ɛno nso yɛahwɛ aban ɛbɛtua enti wei a yɛyɛ nyinaa sɛ ɛbɛboa ama wokɔ district hospital a wontua sika enti wowɔ baabi te sɛ Akwatia wokɔ St. Dominic Hospital wontua wowɔ baabi te sɛ New Dublin wokɔ St. Joseph Hospital ɛsan sɛ aban ɛbɛtua nti no wokɔ a wontua wonhia a health insurance card nso wowɔ baabi te sɛ bono ne ahafonom ne adeade ɛhɔ nyinaa wokɔ polyclinics yi a isisi hɔ bebree wamfie kwatrɛ bɔma ne adeade ne nyinaa wontua wokɔ all these are district hospitals a me bobo de nyinaa wokɔ a wontua sika yɛbɛhwɛ wo free wonhia health insurance card ansa ne yɛahwɛ wo ɛkyerɛ sɛ wowɔ sika o wonni sika o woyɛ ohiani o woyɛ osikani o wokɔ district hospital wokɔ polyclinic wokɔ health center wokɔ chips compound free wontua sika na wei ɛne asɛmpa a ɔmampani John Dramani Mahama ɔde ba na wei bɛboa ama wapɔ mu ayɛ den woyɛ cocoa farmer ehia sɛ wobɛ belong to any health insurance free woyɛ other farmer free fisherman free okuani o deɛ o free wotɔn adeɛ ɛwɔ dwa so wotɔn adeɛ babia free wei ho asɛm ɛna yɛka na wei a yɛde ba no nso yɛnim sɛ ɛbɛhia sɛ yɛbɛfa ɛmaayewa ne maamuwa bebree ɛwɔ asipiti ɛne health care adwuma no mu ɛno nti ɛno nso ɛde enwuma bebree nso ɛɛba ama ɛmaayewa ɛne amaamuwa anɛɛsefoɔ adɔktafoɔ lab technicians physician assistants community health nurses wei nso de enwuma bebree nso yɛ den eba ama wo. Enu nti ye bɔ ne tɔfa na ne aye ka ne sɛ December abato a ye kwa akoto yi da ɛtɔ so nson no. Yentu aba ema omampani John Dramani Mahama. Ono ena waye bida. Nia waye bida ene ye frɛ no aye biafo. Ono ena wasi hospitals akɛseɛ ɛwɔ ye man da. Ono ena nka enye nia oyeye ɛwɔ University of Ghana Medical Center anka ai COVID ai coronavirus yi ɛba yi anka Ghana anka bedi yenya pa. Ono ena wasisi hospitals akɛseɛ Rage Eye Hospital. Several hospitals across the country. Nia eye asefem ene say aban ya etiso yi omo antumi amfa bi anka ho no bebre nso wo ho a omagya amanaka emurem. Enu nti ne ye ka say yento aba ema omampani John Dramani Mahama na emra mewie saa ai hospital projects yi onsi bi krampo so nya den enka ho. Na ne titru onfa free primary healthcare emra sene be ya uko district hospital untua uko polyclinic untua mamobi polyclinic o ehifo untua uko health center untua uko chips compound untua enunti medawase medemano esi.
Thank you very much. So before we wrap it up, Dr. Jehuapia is here, former Secretary, Ghana Medical Association, and one of our spokespersons on health. He has some brief words to share in addition to what Dr. Manibuam has already said. So let's take that. All right, Doc.
Thank you very much. I'll do it briefly. I don't want to take the shine for this brilliant presentation today on what NDC intends to do. I just want you to capture something here. Let's assume that you have something called a germ and a terrain theory. Just imagine a fish in a pond, and the pond is dirty, so the fish is sick. You take the fish out, you treat it, put it back into the pond. Or you go and treat the dirt in the pond, and all the fishes are clean. Imagine this situation. NDC is putting the two together. That as Dr. Omanibuama was trying to say, we are doing health promotion, health prevention, nutritional things, that to prevent people from getting ill. That is all components of the primary health care. It has also been proven that if you clean the environment and do all these promotional things, but what they call it, OPD attendance will be reduced by a whopping 60%. So you will know the amount of money you would have saved in promoting, as I said, the national health insurance. So all this is a package. And if our flag bearer has gone around to listen to you and came back and the health team sat down and put this all together, we're looking at health as a competent a unit that will address all the health issues of Ghanaians. And it's also said that a healthy country is a wealthy country.
So, to vote John Dramani Mahama into office and give us an opportunity to implement these policies and programs, ensure universal access to health care for all Ghanaians, and provide comfort for every Ghanaian. Thank you very much for coming. We will be seeing you very soon. Next week, Tuesday, we'll be in the Central Region for our town hall meeting. When we get back, there will be another presser, this time around on jobs. We'll be talking about the Jumapa. Our flag bearer has said that this campaign will be about issues. To give us a few minutes, we'll get you hard copies of the press statement and see you before you leave. Thank you.